if you have done a mantoux test or tuberculin test and it came out to be positive, now you're worried whether you're having tuberculosis. And many such patients come to us with such reports with positive mantoux test. Maybe the mantoux test is 20 to 25 millimeter in diameter, and the patient is confused now what to do, whether I am having tuberculosis. In this video, I'll explain you in detail and in a very simple way. Watch the video till end. Your all confusion will be clear. Hello friends, today I'll talk on mantoux test, whether a positive mantoux test means tuberculosis or not. And I'll tell in a very simple way and in detail. So watch till end and you will be very clear about that. You have to remember a few points. All the points are very important. The first point is, who has asked you to do this test? If you have done this mantoux test on your own, thinking that after doing the test, probably I'll take medicine of tuberculosis, then it is wrong, because tuberculosis does not mean that you will be having a positive mantoux test. If your doctor has advised this test, then your doctor must be having something in mind that for what purpose he has asked this test, because this test signifies many things, but of course it doesn't signify that positive mantoux test equal to tuberculosis. It's not like that. So first point is, who has asked you to do this test. The second most important point is whether you are having symptoms of tuberculosis, like cough for more than 2 weeks, expectoration for more than 2 weeks, fever, and loss of weight and loss of appetite. These are the very significant symptoms of tuberculosis. Some other symptoms like chest pain, breathing difficulty also can be there. If these symptoms are there, then yes, you can have tuberculosis, but that doesn't mean that after having these symptoms you will go to lab and you will do a mantoux test. You should not do that. This is the second point. And the third most important point is, if you are having these symptoms of tuberculosis, then you must do two tests. One is chest x-ray, another is sputum test. Sputum for tubercle bacilli. In lab they will do a test. They will find tubercle bacilli, the organism causing tuberculosis. If these two tests or one of these tests is positive, then you will be put on anti-tuberculous treatment. But only mantoux test, only positive mantoux test doesn't mean you are having tuberculosis. So remember these 3 points. That's all for today. And lastly, I'll tell you the conclusion. Don't do mantoux test on your own, and seeing a positive mantoux test, don't be worried, don't be anxious. It doesn't mean that you are having tuberculosis. You have to do chest x-ray and sputum test. That's all for today. Thank you for watching this video and stay healthy.